History of polydactyly. Polydactyly has been documented since the ancient civilizations in Mesopotamia. The earliest artistic representation is in the Ain Ghazal in Jordan that has been dated back to approximately 7500 BC. The polydactyly represented in this is located in the foot. Aristotle mentioned this condition in his work on the generation of animals. Later, the Roman Pliny the Elder wrote about hexadactyly, or 6 fingers or toes, as part of his 37-volume encyclopedia, Natural History. The Greek physician Galen of Pergamon wrote about it in his 16-volume On the Therapeutic Method. 800 years later was the next time it was mentioned. This time it was by the Persian Ibn Sina, writing under his Latin name. His work on this was important because he was the first person that stated that polydactyly was caused by natural causes and not something supernatural or relating to religion. In the Middle Ages in Europe, no one discussed polydactyly very much. Multiple people made a mention of it in regard to supernatural or religious occurrences, however. In the mid-15th century, two people, Andreas Vesalius and Ambroise Paré, wrote books about anatomy and both discussed polydactyly. In the 17th century, people began to get rid of the theological explanation for polydactyly and other diseases. People also had very heated debates about whether the embryo was preformed at fertilization or if it grew after fertilization, which is related to polydactyly because the extra digits appear when the embryo is formed. In the 19th century, Francesco Marzullo wrote a book which outlined some general rules for the inheritance of polydactyly. 1. It can be inherited from either parent to a son or a daughter. 2. The direct descendants of a pair of parents where one or both have the condition can have up to 4 extra digits. And 3. The trait can skip one generation. He also did a lot of work to prove and disprove theories relating to the condition. However, his work was largely ignored. Robert Chambers also got similar conclusions independently of Marzullo. Later, Darwin and other scientists would have a debate over different aspects of polydactyly and other diseases. In the early 20th century, tests were done on guinea pigs and fossils were studied to determine more information about how polydactyly works. Numerous other tests relating to other things that have to do with polydactyly, including DNA, were also conducted throughout the century, especially as technology improved. Genetics of polydactyly. Polydactyly normally runs in families, but can also be non-inherited from mutations and environmental factors. It occurs approximately 1 in 1,000 births. Even though it is very uncommon, it is possible for polydactyly to be caused by other genetic disorders, which is called syndromic polydactyly. There are multiple phenotypes. The first main phenotype is called preaxial or medial ray. This occurs on the thumb side of the hand or foot. There are 4 variations of this, types 1 through 4. The genes and other DNA-related things that are involved in this are GLI3 on chromosome 7, band P13, and SHH, or sonic hedgehog pathways, which are located on chromosome 7, band P36. The second major type is central or central ray. This is mostly with syndromic polydactyly, so most of the time it'll be caused by the genes that affect whatever syndrome caused the syndromic polydactyly. The third major phenotype is postaxial or lateral ray or ulnar, which is located on the little finger side. This has 2 types, types A and B. The genes and other things involved in it are GLI3 on chromosome 7, band P13, PAPA2 on chromosome 13, band Q21 through Q32, PAPA3, which is located on chromosome 19, band P13.1.13.2, SHH, MIPOLI, and PITXI. Depending on the type, the extra digit can be a nubbin, or a small lump of soft tissue with no bones, a partially formed digit with some bones and no joints, or a fully formed and fully functioning digit. Effects and symptoms of polydactyly. The symptoms are simply 1 or more extra digits on 1 or both feet and or hands. There are no other symptoms unless it is syndromic polydactyly, in which case any symptoms from the syndrome that caused it will also be present. Treatment for polydactyly. If the polydactyly is expressed as a nubbin, tying it off will work. This is basically where you strangle the nubbin until it falls off. This usually isn't done anymore, however, as the nubbin still contains blood vessels and nerves, which will therefore usually partially grow back, resulting in a foot falling asleep sensation where the nubbin was. This regrowth is called neuroma. Surgery is usually used to remove the extra digit. Recovering the complexity of the operation depends on how developed the extra digit is and also where it's located. Sometimes, especially if it's a nubbin, the extra digit will fall off on its own. If a finger other than the thumb was duplicated, it usually does not need to be removed. It can be for cosmetic reasons, however. If the thumb was what was duplicated, the surgery becomes very complex because the extra thumb can affect the function of the main thumb. If the polydactyly is in the center, it does not have to be removed, but an operation may be performed to prevent deformities. The extra finger can also be removed. Prognosis for polydactyly. Unless it is syndromic or there's a complication with the surgery, the survival rate is 100%. If there is a complication with the surgery, then one or more digits may have reduced movement. How people can help with polydactyly. Because it is a very common disease that we know a lot about there isn't much that you can do to contribute to research. However, treatment-wise, people can donate to charities that provide free medical treatment for people who can't afford it so that they can get the surgery necessary to treat polydactyly.